Thank you, Chairwoman Eshu, for having this very important hearing. The COVID-19 pandemic has drawn the world's attention to the value of vaccines, and the rapid development of COVID-19 vaccines was a direct result of decades of progress in the immunization landscape and laser focus on science and safety and historic investment by the federal governments and the courage of clinical trial participants. While the development of these remarkable vaccines marked a huge step forward, this terrible pandemic has also made clear that we must do more to reduce incidence of all vaccine preventable disease. And this includes taking action to raise awareness of the value of vaccines, improving vaccine-related public health infrastructure, and reduce barriers to access for these life-saving preventative tools. And this is obviously your focus today, Madam Chair. One of the areas where we can most improve is on adult vaccination rates. As our witnesses will mention in their testimony today, while the vaccination rates for childhood vaccines is generally considered high, vaccination rates for adults are lower across the board. These low vaccine rates increase the burden of vaccine preventable disease in the United States. Each year, there are over 3,000 cases of hepatitis B, 40,000 cases of pneumococcal disease, and about 1 million cases of shingles. Vaccination rates in the recommended adult population for each of these diseases are all below 30%. Moreover, only 48% of adults in the U.S. received a flu shot during the 2019-20 flu season. So clearly, we need to explore ways to increase these rates, and one place to look is the approach we're taking with children. After all, over 90% of American kindergartners receive the majority of their recommended vaccines for hepatitis, chickenpox, polio, tetanus, and measles, among others. And those are strong results, but we must remain vigilant. Last week, the Centers for Disease Control and Prevention reported a decline in childhood vaccination rates during the early days of the COVID-19 pandemic, which could pose a serious public health threat. And we also know that there are significant disparities in vaccination rates by age, gender, race, ethnicity, and economic status. Black and Hispanic adults have lower vaccination rates than white adults for every recommended vaccine from the Advisory Committee on Immunization. And only 40% of pregnant women received the 2 vaccines recommended during pregnancy to protect the mother and unborn child. Moreover, only 23% of Black pregnant women and 25% of Hispanic pregnant women received the recommended shots. So coverage of vaccines by private and public health insurance plays a significant role in vaccine access, and lack of health coverage correlates with significantly lower vaccination rates. The comprehensive collection of bills we're considering today would make significant enhancements to vaccine coverage for adults and children in Medicare, Medicaid, and the CHIP program. This includes H.R. 1978, the Protecting Seniors Through Immunization Act, which was introduced by Representative Custer and Bouchon. This legislation would ensure that Medicare beneficiaries are not charged out-of-pocket costs when receiving a vaccine through Part D. In H.R. 2170, the Helping Adults Protect Immunity Act, introduced by Representative Soto, would require all state Medicaid programs to cover ACIP-recommended vaccines for adults and prohibit cost sharing. And then there's H.R. 2347, the Strengthening the Vaccines for Children Act, introduced by Representative Schreier, Joyce, Butterfield, and McKinley, and that would enhance vaccines for children. This program provides vaccines to low-income children by extending eligibility and boosting incentives for providers to participate in the program. H.R. 951, another bill, the Maternal Vaccination Act, introduced by Representative Sewell, would create a public awareness campaign for maternal vaccinations with a focus on communities with historically low vaccination rates. This bill is an important continuation of our work to address the maternal mortality and morbidity crisis in America. And finally, I wanted to mention, Madam Chair, H.R. 550, the Immunization Infrastructure Modernization Act, also introduced by Representatives Custer and Bouchon. This bill would provide funding for significant improvements to immunization information systems. These systems are critical tools for providers and public health systems, but must be brought into the 21st century information age. Increasing immunizations in the U.S. will promote longer, healthier lives while saving billions of dollars in healthcare costs. And as we climb out of the pandemic, our focus cannot be a return to the status quo. Our mandate is to build a stronger and more equitable public health system, and today's hearing, Madam Chair, on these bills is an important step. So again, I thank you and I yield back. Thank you.